are going to present a clinical presentation on the subject of obstetrics and gynecology. We are the members of Group B10. Myself, Ayushi Shah, roll number 74, and my colleagues are Yadnesha Patil, roll number 65, and Chaitali Pawar, roll number 66. So now let's go through the case. On 10th of May 2023, a 45 years old female patient came with the presenting complaints of
पिरियड दरम्यान मला खूप त्रास होत आहे.
that means there is severe pain in abdomen during menses which is unbearable, that is dysmenorrhea. Location was hypogastric region, sensation was of cramping pain which is aggravated in the evening and ameliorated with the help of allopathic medicine, and the duration was from last 1 to 1.5 years.
दोन पाळीमध्ये सुद्धा मला रक्त जात आहे.
That means there is bleeding between two menses due to which she cannot do her daily work, that is metorrhagia, and it is from last 1 year. So now let's see the details of the presenting complaints. Here we will see the conversation between the physician and the patient. Here Chaitali will be a patient and Yadnesha will be physician.
तुम्हाला कधीपासून त्रास होतो? मला हा त्रास 1 ते 1.5 वर्षांपासून होत आहे मॅडम.
That means she is suffering from last 1 to 1.5 year.
तुम्हाला दिवसातून किती सॅनिटरी पॅड लागतात? मला ना 6 ते 7 लागतात आणि माझ्या रक्ताच्या गाठी सुद्धा जातात.
That means 6 to 7 sanitary napkins are required in a day, and there are clots also seen on it.
नेमकं तुम्हाला कुठे दुखतंय? मला ना पोटात दुखतंय मॅडम.
That means there is severe pain in the abdomen, that is hypogastric region.
तुम्हाला पुन्हा कुठे जाणवतं? कसं जाणवतं? मला ना गर्भाशयात असं वाटतं की माझ्या गर्भाशयात कळ येते.
That means there is cramping sensation. Previously treatment taken was of allopathic medicine. There was no major illness in our patient in past, and father and mother, both of the patient were apparently healthy. So the history of presenting complaints: a 45 years old lady came with the complaints of severe pain in the lower abdomen, and there were bleeding between the two menses. The onset was sudden, the progress was gradual, and the duration was increasing pain since last night. So no major illness in the past, and father and mother both were apparently healthy. Menstrual history: there was irregular menses, severe pain during menses. The menarche was at the age of 15 years. Menstrual flow was increased and clots were also seen. The color of the blood was bright red. The cycle was of 6 by 25 days, and nothing abnormality was detected in leukorrhea. Last 3 LMPs were on 10th March 2023, 29th March 2023, and 6th May 2023. Obstetrical history: gravida 1, para 1, live birth 1, and abortion was 0. The duration of pregnancy was of 38 weeks, and the nature of delivery was full term normal labor. Personal history: the diet of our patient was mixed. She was calm and quiet during her childhood, and she was a housewife. She had 1 son and she was religious. Physical journals: the appetite was adequate, that was 3 to 4 meals per day. The urine was 7 to 8 times per day. Thirst was 2 to 3 liters per day, which was normal. There was marked desire for pickles in our patient. And this
pass to the next part. Let the next person continue. Give the mic, let someone else continue.
So by the thumb and chart, we got she was chilly.
Can you go back? Slides here. Go back. Yeah.
Over here, the appetite was adequate, that is 3 to 4 meals per day, and the thirst was normal. There was marked desire for pickle. Thermally, our patient was chilly. Now, let us see the mental general symptoms of our patient. Over here, her husband says, ती घराची सगळं कामं करते, मुलांना शाळेत सोडून देते, त्यांचा अभ्यास घेते, घेऊनही येते, आणि सासूला पूजेची तयारी करायला मदत करते. ती मलाही ऑफिसला जाताना सगळं हातात देते, आणि ती घरातील सगळे कामं करते आणि सगळ्यांची मनही जपते. So it was interpreted that she does so much of work at home, and she does every household work, and she tries to care for all of her family members. मी त्यांना विचारलं की तुम्हाला का ठीक व्हायचं आहे. शी सेड की मला ठीक व्हायचं आहे कारण मी एक हाऊसवाईफ आहे. आणि माझ्यात तितकी ताकद आता राहिलेली नाहीये की मी कामं करू शकेल. सो इट वॉज इंटरप्रिटेड दॅट शी वॉन्ट्स टू गेट इन हर युजुअल कंडिशन सो दॅट शी कॅन कंटिन्यू हर हाऊसहोल्ड वर्क अँड शी सेज शी डोंट इवन हॅव लिटिल बिट ऑफ एनर्जी टू वर्क. And one more thing she added, she is a housewife and she said, ह्या त्रासामुळे जर मला काम करायला जमलं नाही तर मला माझे घरचे विचारणार नाही. So it was interpreted as she said she is a housewife and due to such problems if she is not able to work then she fears that her family and husband might not ask her. Now let us do the physical examination. Over here Ayushi is the physician and Yagnesha is the patient. First, we should take a consent of a patient and introduce ourselves.
माझं नाव आयुषी आहे. आज मी तुम्हाला तुमचं एक्झामिनेशन करणार आहे. तुम्ही कम्फर्टेबल आहात?
Now, let us go with the general examination. First, we see for the build of our patient, that is lean, thin, and tall and mild. Then, we see for the color. We tell our patient to look upwards and see whether there is any sign of anemia. Then, we look for the icterus. We see the bulbar conjunctiva. We tell our patient to look downwards, and we see whether there is any paleness seen. Then we look for the clubbing sign. We tell our patient to make the heart shape. Then we see whether a diamond shape is present between two nails, and if it is present, then the clubbing is absent. Then we look for the cyanosis. For the central cyanosis, we look whether there is any bluish discoloration on the nose and the lips. Then for the peripheral cyanosis, we look whether the tips of our finger and ear pinna are bluish. Then we do a lymph node examination. For lymph node examination, now we do a submental lymph node examination. Then submandibular. Then preauricular. Then postauricular. Then occipital. Then the deep cervical. Then the temperature of our patient was 97.6 degree Fahrenheit, beats 80 beats per minute was the pulse, 120 by 80 mm of Hg was the BP. Everything was normal, and weight was 50 kg. Systemic examination was done. In respiratory examination, there was nothing abnormal, and the air entry was bilaterally equal and clear. And in cardiovascular system, sound 1 and sound 2 was normal. And in central nervous system, the patient was well oriented and conscious. And we do the abdominal examination now. We tell our patient to go into the supine position and get comfortable. Now, over here, we'll do an inspection. Before inspection, we should warm our hands first and then uncover the abdomen. And on inspection, there was nothing abnormal, no scar mark was present. The umbilicus was centrally seen, and no distension was seen, and no discoloration was seen. And on palpation, we'll do the palpation by the ulnar aspect of our hands on all the 9 quadrants in a wave motion. There was tenderness found in the hypogastric region. So, over here, the differential diagnosis of our case was adenomyosis, endometriosis, and the fibroid uterus. Now, let us see the difference between 3 of them. So, what is adenomyosis? The definition is it is a condition in which there is an ingrowth of endometrium, both the components of granular as well as the stromal component into the myometrium.
Endometriosis is a condition where there is presence of the endometrial lining, that is glandular and stromal tissues in the site other than the uterine mucosa.
Fibroid uterus is a commonest benign tumor of the uterus composed of both the smooth muscles and fibrous connective tissue.
The causes of adenomyosis are inappropriate proliferation of endometrium into the myometrium, displaced bone marrow stem cells, altered lymphatic drainage, and the differentiation of the pluripotent Mullerian stem cells.
Causes for endometriosis is retrograde menstruation, coelomic metaplasia, altered immunity, and metastatic spread.
Causes of fibroid uterus are there is a genetic change, any hormonal change, or in a change in the growth factor and extracellular matrix.
Usually, in adenomyosis, age 40-year females are usually affected.
Endometriosis occurs in both old and reproductive age group.
The age group affected is 35 to 45 years old.
The risk factors of adenomyosis is that repeated childbirth and excessive estrogen level in our body.
Risk factors for endometriosis is late marriage, late conception, and adoption of small family norm.
The risk factors are nulliparity, obesity, hyperestrogenic stage, and in black women.
The symptoms of adenomyosis is in 70% of female it is menorrhagia, in 30% it is dysmenorrhea, dyspareunia, and in enlarged uterus, painful menses, infertility, miscarriages.
Symptoms for endometriosis is 25% of the female do not suffer from any symptoms, then dysmenorrhea in 70% of the females, menorrhagia, infertility in 40 to 60% of the females, dyspareunia, chronic pelvic pain and abdominal pain.
The symptoms are 75% symptoms are asystematic, menorrhagia, metrorrhagia, dysmenorrhea, infertility, pressure symptoms. There is a recurrent pregnancy loss, lower abdominal pain, and abdominal enlargement.
Investigation suggested to a patient was USG, then hormonal assay as she was proceeding towards the menopausal age, then anti-Mullerian hormone test to find out the infertility level, and CBC for the signs of anemia, and routine urine test for test of diabetes. These are the investigations. This is the CBC report which is normal, and there is blood sugar level and urine sugar level which was also in the range. The anti-Mullerian hormone test was also in the range, and this is the examination of urine and which was also normal. This is the FSH hormone test which is also in the range, and the prolactin levels are also in the range. The thyroid stimulating hormone test was also done and it was in the range, and this is the report of the USG in which there was found that adenomyosis uterus is there and no endometrial mass. So this is the USG reports. So the final diagnosis is adenomyosis.
So adenomyosis is a condition in which there is an ingrowth of both the stromal and glandular component directly into the myometrium. Now causes. Its causes are idiopathic but may be related to the recurrent pregnancy loss. Its causes are idiopathic but may be related to the repeated childbirth, vigorous curettage, and excess of estrogen. Now treatment. There is no major treatment available, but the presenting symptoms can be controlled by the danazol or IUDs, and other option is surgical treatment. Prevalence. It is seen in the elderly women and the multiparous females, and in 40% of the cases in endometriosis, it coexists with the endometriosis. Now its pathology. It may affect both the anterior and posterior wall of the uterus, but the posterior wall is commonly affected. Now in histology, the stromal cells of the myometrium are surrounded by the glandular tissue. Sign and symptoms. There are painful menses, tenderness in the lower abdomen, increase in the frequency of urination, enlarged uterus, dysmenorrhea, metrorrhagia, and the blood clots are seen. Now, according to classification, our disease is dynamic in nature, which is chronic with the fully developed symptoms, having a miasmatic chronic disease, compound disease, and sauropsychotic disease. According to Kantian approach, this is the evaluation of the symptoms. Cares about family member and household work, which is characteristic mental symptoms, emotion. Wants to get healthy as soon as possible, characteristic mental journal, will. Fears that family member won't ask her, characteristic mental journal, emotion. Desire for a pickle, characteristic particular journal symptom. There is a dysmenorrhea in the hypogastric region.
In the Marathi dialogue with the patient that you have
rubric that you have taken. What is the rubric? Responsibility. Too serious. Yeah, there is a rubric like that. And this is what will come over there. Caring about the family part, where she gives the husband the bag and she does this and she does that and all. The Sasu goes for Mandir. That is, this wants to keep too serious, something like that.
Actually, we took duty taking.
Duty, huh?
Yeah, we took that only.
You have taken
Yeah,
that?
yeah, we took that. Duty taking human sense of humor.
Yes.
Yeah, we took that.
Too serious.
Now there is dysmenorrhea in hypogastric region with the cramping pain that aggravates in the evening, that is complete particular symptom, and metrorrhagia in complete particular symptom. Now evaluation of the symptoms: cares about family members and household work, 3-mark symptom; fears that family member won't ask her, 3-mark symptoms; wants to get healthy as soon as possible so she can do her household work, 2-mark symptoms. Desire for pickle, 2-mark symptoms. There is dysmenorrhea in hypogastric region with cramping pain that aggravates in evening, 3-mark symptoms. Metrorrhagia, 2-mark symptoms, and cramping pain during menses, 1-mark symptom. Now this is totality of the symptom. So I'll hand over my mic to Ayush.
सर उसको इशारा कर रहे सामने देख के
Even the
बोलो
family
खुद
members
से
won't ask her, your translation here is wrong. No? Does not won't ask her, means won't care for her or will not need her, is what she means. No? Actually, that is what the translation should mean. I hope you have selected the symptom according to that. No? Vicharna nahi, means they will not care. I mean, if I don't, that is a pleasing. She wants to please everyone.
She felt that she knew everything.
Yes. So she wants to please everybody. Neglect. Yes.
It was not something like neglect.
Vicharnam nahi mata. That vicharnam nahi is not that won't ask me. Will not care about it. Will not need. Will be neglect. Let's see what you have done.
So now let's see the miasmatic diagnosis. The predisposition, no major illness. Family history were all apparently healthy. Past history, nothing specific detected. Prodrome, complaint started with dysmenorrhea. Functional changes, there was overgrowth of endometrial lining in the myometrium. The pathological change was adenomyosis. Modalities, there was aggravation during evening. General state was weakness. Mental state, duty takes too seriously, cares for other. And the characteristic particular is bright red blood with lots of clot. So the miasmatic diagnosis is sauropsychosis. The conversion of totality into rubrics. Cares about family and household work, that is mind, cares full of domestic affairs about. Fears that family members won't ask her, mind, fear, poverty of. Wants to get healthy as soon as possible to do her household work, mind, duty, too much sense of duty. Desire for pickles, journals, food and drinks, pickles, desire, dysmenorrhea, aggravation in evening in hypogastric region and cramping sensation. So abdomen pain evening, abdomen pain, hypogastric menses during, abdomen pain, cramping menses during, and metrorrhagia, female genitalia, sex, metrorrhagia. So this is the repertorial totality. Mind, cares full of domestic affairs about, mind, fears, poverty of, mind, duty, too much sense of duty. Journal, food and drinks, pickle, desire, abdomen pain evening, abdomen pain, hypogastrium, menses during, abdomen pain, cramping, menses during, female genitalia, sex, metrorrhagia. So this is our repertorial sheet. So the probable remedies are Sapia officinalis, Calcarea carbonica and Pulsatilla nigricans. So now Chaitali will continue.
So now let us see the difference between 3 remedies. So Sapia patient is a hypochondriac patient, and Sapia is a remedy predominantly acts on the uterine. It is a predominantly uterine remedy, and the constitution of Sapia is a lean, thin, mild patient. Desires for acid, sweet foods, spicy foods, and pickles. And the Thamali patient is chilly. In mind, he is anxious towards evening, and indifference is for even for the loved ones. Particularly, it is given in menstrual irregularities, for metrorrhagia, menorrhagia, scanty and profuse menses, even for the cramping sensation pain during the menses. Pathogenesis, it acts peculiarly on female genital tract. Modalities: the aggravation is due to evening, washing, laundry work, cold air, and amelioration by pressure.
आणि
And let us see calcarea carbonica. The patient is fat, flabby, patient is gets easily fatigued, and the patient desires to be magnetized, and patient is thermally chilly. Mind: he fears that he might lose his reason, and he fears that other people might understand his confusion. Particular: it is given in patient who is suffering from vertigo during the menses and even cutting sensation of pain during the menses. Modalities: the patient is aggravated by exertion and by standing, and ameliorated by lying on the painful side. Let us see pulsatilla. As you all know, it is a great and predominantly woman remedy. Over here, the constitution is fair, beautiful lady, and have marked whipping disposition. Desires of fatty food, which causes problems to her, but still she desires, and even for open air. Thermally, the patient is chilly. In mind, she has a yielding disposition. She weeps for a longer time. Weeping disposition is very marked, and she is timid. She is religious, along with she has a fear of ghosts and darkness. Particularly given in the patient who suffers from diarrhea during the menses. And modalities: she feels ameliorated by open air, and she gets aggravated towards evening and lying on the painless side. So our final remedy was Sepia officinalis. Now I hand over my mic to Yatish.
So, according to posology, age is 45 years, sex female have low to moderate, occupation, she is housewife, so less exposure to the stress and strain. Seat of disease is a chronic disease. History of any suppression, allopathic treatment was taken. Symptom similarity, most of the symptoms matches to the remedy symptoms, and constitution is lean, thin, tall and mild. Now the prescription: Sepia 30, 3 dose, 8 hourly, and Rubrum 30, 4 globules, BD for 7 days. Now the therapeutics are Bovista, Belladonna and Semicifuga. Now in Bovista there is a hemorrhage diathesis and bleeding profusely, so menses are too early and profuse. Bleeding is marked at the night. In Belladonna there is acute inflammation of endometrium. Cervical mucosal membrane is a congested and red, and menses are offensive and hot. Now in Semicifuga there is a spasmodic dysmenorrhea, pain in the lower abdomen and bearing down sensation with the pressing pain. Advise: avoid physical exertion, eat fruits and take rest. We suggested some yogas: Sukta Virasan, Malasan and Vajrasan. This is Sukta Virasan. Vajrasan. So the first follow-up was on 18th of May 2023. The intensity of the pain reduced to 30 degree and patient feel relief in journal 20%. So the prescription given: Rubrum 30, 4 globules, 2 times for 15 days. Scope of homeopathy. Homeopathy mode of treatment is very effective in such surgical cases like adenomyosis. This is an article on the adenomyosis.
गया पीपीटी बंद कर दिया.
also further guided by all the 4 departments, and we have a bibliography in which there is a link of the article. And thank you.
All three of you, you all have done an excellent job. And if these were the 9 cases I have selected, I could imagine what you all have done, the other cases must have been like. So I'm very proud of you. And I feel this clinical presentation has reached a peak. And now we need to take it to a much higher level, and I cannot imagine what that level would be. I'm really very, very happy the way you have presented it. And I like that idea of your dialogue with the patient. That was a very unique thing, and also the way you prepared the chart in a different way than different. So this is creativity, and this is innovation and creation. And I'm thrilled with all of you. I'm thrilled. God bless you. We have set an example. I mean, the university, we started this. Now this CBDC that they're talking about, imagine we started CBDC 20 years back. We talked about drops and depths, which about 10 years back, and now the university and the NCH has come up with that. Of course, we have never spoken about this, but when you all will see this, we are far ahead of all of them, and we are already into the new education policy of the government long before they even started it. And yes, I think there is all praise I have written. There is not much I would comment. So keep it up. We have got a long way to go. And God bless all of you. Thank you. So we'll go for lunch. Oh, sorry.
Now, excuse me. No, I am not satisfied with the rubric fear of being poor. I think so. You are mixing Segal's method with Kantian method. You cannot do that. Either you follow Segal's method or you follow Kent's method. It should be fear of being neglected. Because if I don't do this, the other person will not concentrate on me.
A wonderful presentation what you have done with yoga and everything. Yeah, excellent part. And one thing I want to ask, you have mentioned about desire pickle. So can we make it eliminating rubric, and Sapir covers how much marks for desire pickle? Just take it out of interest and let me know. Okay. Otherwise, wonderful presentation. You have done all clinical examinations and all aspects, even homeopathic aspects you have covered very well. Thank you.
The presentation was up to the mark. The beautiful part was the templates which you used in your presentation. All the examination was done. I don't agree with one thing, that in the miasmatic diagnosis you mentioned that housewife is having less stress and strain. So I think she is the most I can say she is the person who is having much stress and strain. Okay?
Yes, I agree with that. She has, in postology, you have made that statement.
Less stress.
I
The
should
yoga.
ask your mother, tell your mother that I wrote this. I think the housewives are the most stressed.
In the follow-up, if you are taking any gynec or obstetric case, so follow-up has to be in detail. Your case was having metrorrhagia, so in the follow-up you didn't mention how many sanitary napkins she was using, okay, and about the bleeding, okay, the quantity of bleeding. Yes. So that has to be there in your follow-up.
Talk in English.
Sir, hemoglobin level is asking.
So we'll go for lunch. We'll come back at 2:45. Dr. Modi has come.